open wound. And so it's not like getting like a little gash or something. These are like, large size open wounds on people. They have to amputate their limbs. And it smells like rotting flesh, which is disgusting. It's just absolutely disgusting. So that's one of them. The other one is this, xylazines. Xylazines is even, to me, it's scary on a different level. Because when it comes to xylazines are a tranquilizer, but when you think of the word, it goes by trank. So if you ever hear trank, they're talking about xylazines. The thing about xylazines, even though it is used by veterinarians as a tranquilizer to put animals to sleep to do surgery, it is not an opiate, like carfentanil is. Carfentanil is for vets, it's an opiate. It has the characteristics of an opiate. If somebody takes it, you will see that same manifestations, but it is not an opiate, which means it goes to a different part of the brain. The reason why this works, the reason why Clexato and naloxone works is because this is an opiate. It just affects our receptors completely different. So because this is an opiate, it automatically goes to our part of the brain that tells us how we feel, right? So that's why it works on heroin, traminols, all of those legitimate prescriptions, over-the-counters, illegal drugs, any kind of opiate-based substance for pain goes to the same part of the brain. Clexato, naloxone, Narcan, they're all the same thing. They go to that same part of the brain as well too, because it's an opiate. That's why this works. Because xylazines go to a completely different part of the brain, that doesn't work on it, right? The reason why naloxone doesn't work on coke or meth or stimulants because they go to a completely different part of the brain. Naloxone only works because it goes to the same part of the brain that majority or most opiates go to, right? So that's scary as well. But we don't have a whole lot of information. That's literally about all the information the state has given us about that. This is what the state says to help us determine if we think somebody could be overdosing. For some of us, we're going to recognize it. We've seen it. We know what it looks like, right? However, there are people who have never seen an overdose. And so this helps us. My thing is this. For those of you that know about naloxone, David, don't answer the question because I know you know. What does this work on?
I'm sorry, what was the question?
What does this work on?
What do you mean?
Like, what substances does this work on?
Anything except for that one. Opiates, stuff like that.
So it only works on opiates, right? That's it. That's all. This is the only thing this works on. If somebody is intoxicated, this has no effect.
Right.
Right? If somebody is having another medical event, heart attack, stroke, diabetic event, that has no effect.
Right.
It only works on opiates. So my thing is, you see somebody, if you suspect an overdose, start giving it. Because if you find out later they're having some other medical event, Narcan or naloxone is not going to hurt them, but it's not going to help them either. If you find out later, oh, they were having a stroke or heart attack, and I gave them 9 of these, right? It's not going to help them, but it's not going to hurt them as well. And you're still covered when it comes to the Good Samaritan Act, which we'll talk about later on. So I always say give it sooner than later. Now, you weren't here when I was talking about the 4 stages of breathing, but there's 4 stages a person will go through when they use a substance before they pass away. Their breathing will become slow, irregular, agonal, or snore-like, and then their breathing will stop. The third one, it goes by chicken breathing, death rattle, death snore. It can and does sound like somebody's snoring. However, the person isn't actually breathing. It's more like a gasp. So you hear the sound, and then you hear that pause. Those pauses get longer and longer in between each one until breathing completely stops. So how do we know if somebody is sleeping or if somebody's having an opioid event? Because people have died with others around them that could have helped but didn't because they thought that person was snoring. They hear that and they go, oh, she's out, he's out. No, the person wasn't agonal breathing. There's one thing we do. We do the sternum rub or stimulus rub, right? That is going to be the one thing that we are going to do that will cause physical pain or harm. Mm-hmm. Have you ever heard of that? Mm-hmm. Okay. Has anybody ever?
Yeah. I've done it, yes.
Okay, does it feel good?
No.
So if you're not familiar with it, do your hand like that, thumb on the inside, wrap your fingers around. And like they said, you press as hard as you can on a person's breastbone or sternum. And I'm sorry, I forgot my manners. There you go. You're right. And so the sternum rub is going to be that one thing that we're going to do. It will cause physical pain or harm to the person that we're trying to help. And that's okay, right? Because if the person is sleeping, I guarantee you they're gonna wake up. If the person's intoxicated, guarantee you get a response. You do the sternum rub and you get no response, there's a good chance that person is having a serious medical event and or an opiate event, right? But that is the one thing that we do. The sternum rub replaces kicking, punching, slapping, right? Because if we're in a motel room, we freak out, we think the person we just got finished using with is gonna die. We resort to kicking, punching, slapping, trying to get a response from that person. Something else is vomiting. Vomiting is on the list because even though that person is still unresponsive, the body is still trying to purge and get the garbage out. And so typically the state will say, and there's the recovery position, if you want to pass it around. Typically the state says when you start giving naloxone to somebody and you start seeing positive signs from that person, the person that was unresponsive, you start seeing finger twitches, eye flutters, moans and groans, those are your indicators that, yes, this person is having an overdose and naloxone is starting to work. When you see that, roll the person on their side, like the recovery position, and I'll show you a slide later on. And whatever leg is on top, you're gonna bend down towards their chest to prevent them from rolling back over on their back. Because, and it's ironic, that a person has been saved, from an overdose, but has passed away because they aspirated on all of their vomit. And so just to prevent that, we roll them over on their side. Now, for me, what I do is, when I'm at the National Rescue Mission, I don't wait until the person gives me a sign, because there are a lot of cases where the person won't. You'll give your second, third, fourth, fifth dose, and all of a sudden, person just comes to me like, oh my gosh, I forgot, you didn't have a chance to put them on their side. So for me, my first dose, I automatically roll them over on a recovery position, because that person may not give you any signs that naloxone is working. So the state put this in our presentation because they believe there is a fentanyl panic. It's already difficult to get a stranger to help another total stranger, right, with anything, flat tire, whatever. Now you factor in fentanyl, and people think, well, I'm not helping because if fentanyl is there and I touch it, I'm gonna die. And that's simply not the case,
no.
Right? There's two types of fentanyl. There is the FDA created fentanyl, which was created back in 1958 or 59 for cancer patients, and so it was a patch. FDA created fentanyl added a compound to it to make it absorb through the skin, because fentanyl is man-made. Illegal fentanyl or illicit fentanyl that we see in 97 to 98% of our products doesn't have that added compound. So if you pick up a dollar bill at McDonald's that may have been in contact with fentanyl, before you wash your hands, you do this, right? You pick your teeth, you smoke a cigarette, you have a cut on your hand. Illegal fentanyl has to get into your system by some other means than simply absorbing through the skin. That's the biggest takeaway. So you help somebody, you don't know if fentanyl was present. Before you touch any part of your body, wash your hands with soap and water. Biggest takeaway, all right? Here is, I always chuckle when I get to this slide. Here is what not to do if somebody could be having an overdose. If it's up here, it happens. Do not put a person in a cold bath or a shower. Or I hear that more times than anything. Or putting ice on different parts of the body, right? The reason why, and I'm not saying that first one doesn't work, because it does, right? But the reason why it works is because we're doing what to that person?
Basically shocking.
Yeah, we're shocking the system. Putting a person in an ice bath or a cold shower or putting ice on different parts of the body has the same effect on that person as somebody jumping out at you in a haunted house or a closet. For that split second, you're like, oh, and your heart wants to go, boom, 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 boom. When we do that with somebody, the heart is doing this. It's trying to come to a stop. It's beating slow. When we shock the system, we're forcing it to try to speed up and beat faster, to pump more blood and oxygen. Doing that, person may come out, 50% chance, 50% chance or so the person will have a cardiac arrest, right? So there is, it does work, it can work, but we're shocking the system. Obviously, if you have naloxone, that is the one thing you want to do. You don't want to inject it with anything. It's a no-brainer. We see the rationale, right? Slowing down, give them something to speed up. You don't want to do that. Salt water or milk, I have no idea why you would inject somebody with salt water or milk, but people do. Almost 3 years I've done this, I have yet to have anybody, doctor, whoever, give me a reason for those two. Maybe saline, but I don't know. You don't want to give that person anything to eat or drink. Remember, the body is trying to purge to get the garbage out. You don't want to force anything down. Same thing here, you don't want to give them any over-the-counter stuff. Again, you're forcing the heart to speed up faster, but we're also forcing something down. This includes Red Bull, right? Because I hear this quite often.
Okay.
People giving somebody an energy drink to help them get going again. You don't want to do that. And lastly, we talked about that. The one thing that we're going to do that will cause physical pain or harm is that sternum rub. That is it. When you do the sternum rub, do not have the mindset of, oh, I want to hurt that person. You put your whole self into it, right? If you Google it, you will see people now in the hospital with severe bruising and abrasions all over their chest. That's okay, right? So, when we give somebody naloxone and we save their life, have we gotten rid of whatever substance they've taken? Are you sure? Absolutely right. That's a big misconception, right?
Right.
And I see the person, they were dead, now they're looking up and sitting up and looking at me, they're good, they're fine, right? They're not. Because this is not the purpose of Clexxyl or naloxone or Narcan. The purpose of this is not to fully bring anybody out of an overdose. The purpose of this is to give somebody a small chance or a window, make it on an ambulance, and get to the hospital. That is where somebody comes out of the overdose. People think this is fully bringing somebody out of the overdose. It does not. So what that means is the substance, whatever somebody took, is still floating around in their feel-good center. By the way, who knows the name of our feel-good center? Who knows the medical term for that? Anybody? Anybody ever see Waterboy?
See what?
The movie Waterboy?
Yeah. Oh my God.
It was in there.
I love my God.
Yep. Yeah, medulla oblongata.
Yeah.
That is our feel-good center, right? So that is where any kind of opiate goes, all right? Now, the substance, whatever that person has taken, is still floating around in their medulla. It just doesn't have enough receptors to bind to at the moment to cause an overdose because naloxone has replaced it. When naloxone starts to wear off, because we don't know anybody's tolerance level, we don't know when naloxone is going to wear off, we just know that it will. The substance that's still in their brain is going to reattach. It is going to rebind to their receptors, and that person will have a secondary overdose. I've seen it all the way up to 5. Individual had such a high tolerance and he ingested a powerful substance. He had 5 overdoses before first responders got there. So hear me when I say this. The higher your tolerance and the more powerful substance you ingest and or just the sheer volume of what you ingest has a direct relation on how long this lasts in your system. So you see 30 or 90 minutes. That is for somebody that doesn't have a high tolerance, right? You have a high tolerance, you can ingest more and a more powerful substance. This will last 10 minutes, 8 minutes, 7 minutes, 5 minutes. That has a direct relation on how long this lasts in your system. So, let me say this as well too. Do we know anybody's tolerance level? Can we honestly say it's only going to take 2 doses?
No.
You will probably, if you haven't already, will have somebody tell you that. Unfortunately, it may be a first responder. No offense to these first responders in here. I had one tell me when I first started, only give 2 doses. That's it. If it works, fantastic. If not, just when they're dead. Exactly how I explained it. I'm like, what? So there's 3 ways or 3 guidelines when it comes to how many individual doses you give. You give naloxone until you don't have it. However many number that is, whatever number that looks like. 2, you give naloxone until the person responds. And 3, you give naloxone until first responders arrive. You have 9 doses, you keep giving your dose. I give my first one, wait 2 or 3 minutes, no response. Second one, wait 2 or 3 minutes, you keep repeating that process. Now, having said that, 3 things will cause that person not to respond to naloxone. 4, if you factor in the new xylazines, right? But 3 main ones. 1, that person is having some other medical event. Heart attack, stroke, something else, diabetic event. 2, that person's tolerance is so high and or the substance they've ingested is so powerful, it is going to take more individual doses than what we gave them. And 3, from the time the person overdosed to the time we got there and started administering naloxone, too much time has passed. So unfortunately, in that situation, the person's passed away, unfortunately, because there is a time limit. Sometimes people ask me, well, how long do I have? It just depends. Each person is completely different, but there is a time limit, right? So again, if you've given every single dose, there's been no change to their condition, their tolerance is so high, it's gonna take more, they're having another medical condition, or too much time has passed and they have passed away, unfortunately, okay? It will be one of those 3. So here are the main versions or main ways to give naloxone. The first 2 obviously are the nasal spray, the 4 milligram dose, right? And then we have the double strength 8 milligram dose. When you hear naloxone, Narcan, Clexato, those are all interchangeable. Naloxone is the active ingredient, but Narcan is the brand name, Clexato is the brand name, but they're all the same. If you come across the intramuscular one, the best place to give the injection is going to be between the elbow and the arm, so somewhere up here in the bicep. All right. Recapping, we see our good Samaritan, he or she is doing the sternum rub. They're trying to determine what's going on with this person. When you go to administer Narcan, if you have never done it, 2 of these in every box, and each one is in its own little blister pack. You simply just peel the back off, pop it out, insert it in the person's nose, and you squeeze 1 time. When you squeeze it, like this one, you see how the plunger stays up, right? There is no way to only partially depress the plunger, right? Because this has a shelf life of up to 36 months. So you can have this for over a year and are finally getting ready to use it and thinking like, will this work? It'll work. If you get curious and test it to see, you just used it, all right? So you don't have to shake it, you don't have to prime it. This can get hot for a little bit and cold for a little bit. Warmer weather is coming. You don't want to put it in direct sunlight, but if you want to keep it in your car, you can put it in center console, glove box, trunk, just not direct sunlight. And don't want to put it in the fridge, all right? Dial 911, we still call 911 even though we have naloxone. When it comes to chest compressions and CPR, if you are certified at the time you were trying to help somebody, then you're okay with doing chest compressions and rescue breathing. From what I understand and what I'm being told, when people are getting trained by the Red Cross now, they're not even doing the rescue breathing. They're just teaching them the chest compressions, right? But no, when you're talking to 911 dispatch on your phone, if they ask you to do rescue breathing, just know you don't have to, right? Because most of us are first responders. We're not going to walk around with mouth guards. You don't have to do rescue breathing, huh?
I do.
You do?
I have it on my keychain.
Good for you.
Yeah,
I keep telling
yeah.
Really? Can I see one? I mean,
I don't have it on me.
I keep telling myself.
We're in a different car, we got a new car.
Oh, really? I keep telling myself I'm going to get it.
It's a little bitty red pouch. It looks like a little bitty change pouch maybe. So, about like this tall.
Okay.
Wide. I mean,
On your
you wouldn't
keychain?
think it was it.
Okay.
And the
You open it and just
aspirator
take it
will
out.
come back in.
Yeah.
It's one way.
One way. So if it has fentanyl or something, you have that barrier there, because sometimes that question comes up, like if I do it and they have fentanyl in their mouth, can I get it? Yes, you can. But if you have that, you won't.
Yeah,
I'm
that's,
gonna do
yeah.
Because I keep telling myself for a year, I'm like, I'm gonna get it. I've never done it. So for most of us, it's time for awesome people don't carry mouth guards. So just know you don't have to do rescue breathing. You can just say, you know what, I don't feel comfortable. Maybe the person, when they nodded out and passed out, smacked their face, and this is all bleeding or messed up, you're like, they'll walk you through doing chest compressions. If you are not CPR certified, please wait for 911 dispatch on your phone to walk you through, because they'll ask you for updates. Check